In principle, surgical techniques should be effective, patient-friendly, or in other words, low pain, and result in as few complications as possible. To a great extent, these criteria are filled by the minimally invasive methods HAL and RAR. The following diagram represents an assessment made by AMI regarding the effectiveness, safety, and patient-friendliness for the various methods of treatment. It is based partly on the data published in the literature and partly on evaluations made by surgeons who have experience with the HAL and RAR methods. Up until now, the international gold standard for the surgical treatment of high-grade hemorrhoids was the conventional hemorrhoidectomy. The method's safety is described as normal to good. However, as the method is accompanied by quite high pain levels, the relatively low patient acceptance that results presents a considerable handicap. In addition, the wounds take quite some time to heal. This means that in many cases, a return to everyday life is not possible for several weeks. The method is rated particularly high because of the good cure rate for hemorrhoidal prolapse. However, the cure rates for those symptoms related to hemorrhoids such as bleeding, itching, and pain are less impressive. Outpatient procedures such as rubber band ligation, which is relatively safe and patient-friendly, display considerably lower cure rates for high-grade hemorrhoids and are therefore only of minor significance in the spectrum of hemorrhoid treatments. The main advantage of the stapling method is its patient-friendliness. However, reports of both intra- and post-operative complications can be found in the literature, some of which were also serious. Therefore, the level of safety is to be considered as lower for this procedure than for others. Results also show the stapling method to be inferior to the gold standard in terms of long-term effectiveness. The reprolapse rates are significantly higher than for those for the conventional hemorrhoidectomy, while cure rates for the symptoms are lower. Where does the RAR method fit in? The method is minimally invasive and displays excellent results in terms of safety and patient friendliness. Up until now, there have been no reports of serious complications occurring after HAL or RAR, although tens of thousands of patients have been treated with these methods. The very low level of pain allows patients to return to their normal routine very quickly, so the method can also be viewed favorably in economic terms. One criterion for the method's effectiveness is the reprolapse rate. Here, the RAR method seems to achieve very good results. The publications available to date on the RAR procedure describe success rates in some cases equal to those with the conventional hemorrhoidectomy. A second criterion of no less importance in judging the effectiveness of a method is success in treating the symptoms. Current findings indicate that bleeding, itching, and pain are cured even more successfully with HAL and RAR techniques than with other methods. It is highly likely that this success is due to the decreased blood supply caused by the precise ligation of arteries. All in all, the RAR method shows very good results for all criteria: effectiveness, safety, and patient satisfaction. One further advantage of the HAL and RAR methods, which should not be underestimated, is the fact that the operation can be tailored to suit each individual patient. The result is that all grades of hemorrhoids can be treated effectively. In summary, HAL and RAR are minimally invasive procedures effective in both short and long term for all grades of hemorrhoids.